really need you now. Oh, yeah. Just set me free, freer than the open mind, farther than the eyes can handle, freer than the ocean now. Yeah, yeah. So set me free. Now I need to find me. Set me to the open sky. Now I need to free my mind. Yeah. Boom, 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 boom. Boom, 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 boom. Hey, I don't, yeah, oh no. I might be falling deep. 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 Tell me now what you need. I've been going to God when I'm only in my mind. I might be falling deep. Falling deep. I might be falling. I might be falling. I might be falling. I might be falling. Yeah.
Eden Brothers. And even brother Paul Mark with the one R. So I did make the reservation because I tried to do it the other day and all the hotels were booked. And then when you said the link, that explained, because there's only 2 hotels in that whole area.
Okay, Brother Brian, we could talk about that offline.
Yeah. All right, but we're good now, though.
Okay, great. Thank you. Thank you.
Good evening, brothers.
Good evening.
Good evening, good brothers. Good evening.
Waka waka when you enter Malicha. Baby, kona. Will you give me sugar? Wahala. Macho Mona Lisa. Macho Mona Lisa. Macho Mona Lisa.
Brother Bradshaw, you've got the con. All yours.
Good evening, everyone.
Good evening.
Good evening. Well, we can do better than that. Good evening, everyone.
Good evening.
Good evening.
Good evening.
All right. I'm excited about this evening, and hopefully you are too. My name is Paul Bradshaw. I'm the trusted messenger for this evening. Welcome to the Know Better, Live Better Health Literacy Forum, sponsored by the New Rochelle White Plains Alumni Branch of Kappa Alpha Psi. Oh, brothers, that was a cue for you right there. In conjunction with the Westchester County Department of Health. Before we get started on this evening, I want to bring to the platform at this time our poll mark, Brother Derek Griffin of New Rochelle White Plains alumni of Kappa Alpha Psi. And after he brings his remarks, the next voice you will hear is one of our program staff members, Farah Kadar.
Thank you. Thank you, Brother Bradshaw. And good evening and welcome, everyone. And it's great to see some familiar faces. I know some of you were with us a couple of months ago when we rolled this out. We got a really good response from a lot of you, and we're deciding to do this again. And why is this important? We talk about the trusted messenger. We talk about delivering this information in our communities. And a lot of us hear a lot of false information. So this is the reason why we're here, and we're partnering with Know Better, Live Better to make sure that the information that's coming out and delivered to your communities is accurate and truthful information. So again, I just want to welcome you all. Thank you for joining us. I'm going to turn things over to Farah, and I'll close out a little later on with some closing remarks. Thank you.
Thank you.
Thank you so much. Hi, everybody. I'll be brief. So before we begin the program, I'm going to put a couple of links in the chat. One of them is a survey. It's a completely voluntary, anonymous survey. If you've been with this group before and have seen this presentation before, you do not have to complete the survey. And again, it's totally optional. The purpose is to collect information for a research study that we're doing about the effectiveness of community-based health programs like this one. CAPA has been an excellent partner with us in helping us determine, how effective it is to have community-based, discussion-based programs. So we will ask a few questions on the survey about health behavior, beliefs, and your experience with the healthcare system and healthcare providers. The survey will be confidential. The researchers will be reviewing the survey, and we're all from the Westchester County Department of Health or our partner Mercy College. If you have questions, comments, or complaints about the survey or anything you hear or see today, you can reach the program staff using the contact information on the first page of the survey. If you decide to participate, we'll be using your responses for potentially publications. The data will be analyzed, but there will be no personal information tied to that data. We may, again, share this information with other health departments that may want to know the effectiveness of this kind of program, what could be done better, and whether it's worth replicating in the future. We will use the email that you used to register for this Zoom conference to send you an Amazon gift card for $10. This is to compensate you for your time and participation, not for survey completion. Again, you will still get this gift card if you leave the survey questions blank or if you don't fill it out at all. So I'll first put the survey link in the chat, and then I will also put 2 handouts in the chat. These handouts are for you to save and look at your own leisure. They are resources that we've collaboratively put together with our partners, including CAPA, and takeaways from this program. So with that, I'll turn it back over to Paul.
Thank you, Farah, for that information. Once again, good evening and welcome to Know Better, Live Better. A few of our goals on this evening is 1, to increase our health literacy. Meaning our ability to find, understand, and use information and services to make informed, healthy related decisions. We're going to be covering really tonight COVID-19 to apply what we'll be learning. But feel free, if you have any other health topics that you would like covered or discussed, please feel free to do so. I'm facilitating, but this is really not about me. It's about everyone that's on the call on this evening. Your participation is welcome. We hope that everyone gets involved so that we all can learn and know what it is and what it means to know better, live better. I'm going to give everybody a few seconds to look at the quote by the late, great Maya Angelou. And as you're looking at that quote, the question I have for you is, how can this quote apply to our health? Anyone can chime in the chat or unmute yourself or raise your hand. Once again, we student engagement. We want everybody to be engaged. Everybody that's on the call, engage. Feel free to participate. Give your remarks. So it says, do the best you can until you know better. Then when you know better, do better. Can someone tell me out there, what does that mean to them as it applies to health?
I'll take a stab at it.
Okay, thank you.
As I was growing up, your parents always stressed, how you eat your vegetables, for health reasons. And growing up, I think I ate a lot of canned vegetables, but as I got older, while vegetables, canned vegetables aren't necessarily the best vegetables because of all the additives that are added to them. And so learning a little more about nutrition and what's in the food causes me to eat fresh vegetables now. I don't eat canned vegetables now, right? So as it relates to my health, I think I got a better diet where I get more nutrition from the vegetables I eat rather than the ones that I used to eat. While the information was relevant then, and because we probably couldn't do any better, I know a little better now, and therefore I think I do best with my health.
Wow, that was great. Thank you for sharing that experience. Very enlightening. Anyone else like to share?
Hey, Paul.
Go ahead.
I can definitely say, when it comes to health, black men have this stigma when it comes to the doctor. Going to the doctor, when we know that we're supposed to have those annual checkups, or if we know we're feeling uneasy, but we just kind of just blow it off. And we know better. And of course, we're supposed to do better. And then sometimes we wait till the last minute, or we still just don't do anything at all. So that's just one of those things that stick out. So when I know my body, okay, I don't feed into the stigma. I make sure I take care of my health, because of course, as we all know, health is wealth.
Yes, and thank you, Mark, for sharing that as well. Health is definitely wealth. And one thing about our bodies will tell us when we need to go to see the doctor or when something's not right.
Absolutely. Absolutely.
I'll listen to one more if there's another we'd like to share before we continue. Once again,
Well, I think too, sometimes, the listening to health is one thing, but the other part too is why you getting the checkups, like what is it? One of the biggest killers that we have is cholesterol, which is a silent killer. So in that case, you can't listen to your body because you're not hearing anything, but you need to go get tests. And I look at this as when you know better, you do better. Once you go to the doctor and get tested and you see your numbers, you know what you need to do better, so you can live a lot longer and a lot healthier, and try to do as much you can to minimize shortening your life.
thank you, Derek. And you bring up a very good point. Although our body will tell us many things, it won't tell us everything. So you're absolutely right. So it is important that we definitely go get those routine checks. Thank you. As we continue through this, I call this some housekeeping, because like I said, we want to get everyone involved, but we want to make sure that we're creating a platform where people feel respected and their voices are heard and valued. So with that said, how can we have a productive and respectful conversation on this Zoom platform tonight? Anyone want to share their ideas on how we can make sure that everything that happens on this evening is meaningful, productive, as well as respectful?
Well, we have to respect people's lived in experiences. I find that we try to place ourselves in someone else's situation, and oftentimes we feel like our experience supersedes somebody else's experience. So we need to be respectful of those experiences that we've had, because we may not have a perspective that person has. We need to be open to change and open to growth.
Agreed.
Love it, love it. Thank you. And we, in addition to that, when someone is speaking, let them complete their thoughts without any interrupting, respecting individual choices, and understanding that everyone is coming from different places as we deal with this topic of health. So thank you. On this evening, what will we cover today? We're going to continue to talk about what does it mean. We're going to dissect what does it mean to know better, live better. We're going to talk about finding trusted health information, as well as preparing what to do to prepare for that visit, as Brother Brian had mentioned earlier, when it's time to go and get your routine checkup. Can somebody out there define for the audience what is a chronic disease? When we talk about chronic diseases, what are we really talking about?
It's a disease that one suffers from consistently. Something that's, in contrast, something that's an acute disease would be something that comes on very quickly and may go away very quickly. But a chronic disease may be something like, diabetes, COPD, something like that people deal with over a prolonged period of time.
Okay, thank you. Anyone else want to add to that? Diabetes is definitely an example of a chronic disease. When you look at that stat there, 8 out of 10 people in Westchester County reported having one or more chronic diseases. And the key there says reported. So when we look at that, just looking at that stat, we're talking about basically 80% of the population in Westchester. But that's those that are reported, which means it's probably even higher than that. So when we talk about assessing healthcare, finding information, fighting off infectious diseases, how can we make sure that we're protecting our community from some of these chronic diseases, such as high blood pressure, diabetes, depression, anxiety, asthma? What can we do to protect our communities and educate and enlighten more of our people about this? Can someone give me some examples?
I guess going back to what you first said, if you know better, you do better. And I think too, it's also going back to what said earlier, it's also, I guess, I don't know if it's the black male thing, but also it could just be in the family where you just don't talk about it. And so you talk about going to the doctor, and you talk about why you go to the doctor, and you make it a part of a normal conversation so it doesn't sound weird. And you say, hey man, did you get your checkup? You get your physical? Hey man, you're over 50, you need to, go out there and get a colonoscopy, just something where, you have the conversation. And if it's something that's done on a regular basis, it's not something that feels like it's a taboo. It's something where, oh yeah, I got my checkup yesterday. Like my brother and I and my cousin today, we just talked, oh man, it's the fall. We gotta go get our COVID shot, get our flu shot. And now we got to get the shingle shot. So of course I did my thing today. I made my appointments for all 3 today. I mean, my appointment to get it done within the next, next week and a half.
No.
Yeah, and two, just to add to that, to my namesake's point, we still have a lot of men out there that, don't want to go get that colonoscopy done for one reason or another. And me, because of my family history, I started getting mine from the time I turned 40. And there's still a lot of people out there that don't do it. And I try to convince them, listen, you need to go get this stuff done. Don't wait till it's too late. And that's something that we need to do. And with programs like this, where we're having these conversations, having these discussions, is where we're going to help drive some of the men, especially, to go get checked out. And like was mentioned earlier, you're 100% right. Us men, we don't go to the doctors as often as we should. We'll have all kinds of aches and pains and wait until it's too late to go get them addressed. So these programs are really going to help us. It's going to help our communities as well.
I'd like to add a little something to that as well. I think, we have to continue to educate ourselves, our community, about health. But I think, particularly as Black men, we need to begin to hold each other accountable for doing these things, right? We have these conversations, I believe, in passing sometimes, and we kind of let it go. But I think we need to start getting in each other's business a little bit more to make sure that these things are happening. Because too many people, too many of us are passing by, and all we do is wish that we had held those brothers accountable to getting that colonoscopy, getting those angiogram, getting those, those prostate checkups, and all of those things. So I think that's a big part of it.
Yeah, no, good points from all of you. Very good points. I also want to address some things that's in the chat that I missed a little earlier when we talk about chronic diseases, and people were given some of their definitions of serious disease, anything that lasts 3 to 6 months, longer than 3 to 6 months. Examples: asthma, diabetes, we talked about, congestive heart failure. So some good things in the chat as well. Hypertension. Early prevention leads to better outcomes. I like that, Erica, which brings us to our next slide. Prevention is the key. And when we talk about prevention, we talk about how do we stop, and we talk about getting vaccinations and things of that nature. But we also got to look at setting goals for ourselves. Whether it's, I'm going to make sure I go to the doctor every 3 months. If I know I'm overweight, what am I going to do to decrease that weight? If I know I'm suffering with something, my sugar intake is too high, what am I going to do? So I want everybody to think about, reflect on where you're at in your health right now. Whatever it is that you're going through, make it personal right now. And I think it's good. Let's put in a chat. Let's talk about it. What are some of your health goals for the future?
I kept standing. I can't.
I'm going to start. I'll start, and then hopefully we'll have some things in the chat, and or just unmute yourself. I make it my business now. I told myself I need to race my heart. Unfortunately, in my family, we suffer on my dad's side from heart failure. Everybody on the men died of heart attack, so I'm at high risk. So I got to watch my intake, watch what I'm eating, and exercise. So I've been trying to walk at least every other day 2 miles. So that's one of the goals that I set for myself for this year. Anybody else want to share? Because when we share and we give testimonies of things that we've done to improve our situation, it gives inspiration to others. So is there someone who would like to at least share a goal or talk about something, an experience that they're going through currently, or something they've done to help their own health situation?
You have a lot of good responses in the chat there. You're gonna go through the chat. They're
All
filling
right.
it up. They're filling up the chat.
All right, let me go through them. Here we go. Monthly checkups. Yes. Thank you. Avon Johnson. Kevin Smith said setting goal next year to walk 300 miles before the year ends. Like that goal. A massage. Katie and Russell, a massage once a month. Sure, I wish I could get that once a week. I like that. Erica said stay informed with evidence-based practices. Love it. Sandra said yes, she's encouraging me and everyone else to get those numbers down. Giving time for rest. I like that. Sibi, if you don't mind, would you like to unmute yourself and just speak more to that? Because I think that is so much time, so important. And I don't think we get enough rest or the amount that we should. I don't want to put you on the spot, but if you don't mind, you want to talk a little bit more about that? I can't see everyone, so if she's speaking, maybe unmute yourself. I'm not sure if is she stood up there, Sibi Kate? Hopefully I'm saying her name correctly. No? Okay. Derek put in a testimony out there. I just found out about being a weekday vegetarian. Vegetables all week, and then you can have meat on the weekend. So far, so good, and it's lowering my cholesterol level. Brandon says tracking meals has really helped. And Robert Bowen said he works out 3 times a week. Brandon also chimes back in counting calories and keeping portions under control. Sandra, Derek gave you a shout out. I need to consider doing the same. All right, so this is good. This is good. But also don't be shy. You can unmute yourself and share out loud. Herb?
Yeah, Paul, I'm gonna, speak to that sleep thing, I remember working out with a trainer, my diet was good, I was exercising and everything, but I wasn't losing any weight. And one of the questions that the trainer asked me is, how's your sleep? At that time, I was getting probably 4 or 5 hours worth, 4 or 5 hours of sleep a night. And then when I consciously tried to get more, and I eventually did, that's when the weight started coming on. So sleep is just as important as diet and exercise when you're doing weight management.
Yes, I totally agree. And some of us have jobs and work schedule where it makes it difficult, and we got to get that rest in whenever we can. But I'm a fan of power naps. I don't know how many of you out there enjoy a good power nap. I'll take a nap during the day at any time and get a quick 45 minutes, an hour, or what have you. And I find we got to get it in whenever we can, because I do think we're wearing our bodies down because we're not getting enough rest. We may not feel it now, but as we get older, the wear and tear on our bodies, we really start to come to light.
Yeah, so one thing on that was good to know. Like I have this, we do this whole My Fitness one, but there's My Pal, Fitness Pal, and that one you keep track of your numbers. And what I find is, for trying to keep the weight down or whatever, I find the hidden one also as well. Like they'll tell you, you got to watch the calories, you got to watch the carbs. The one that I actually found that is a big driver is the sodium. And the sodium, if the higher the sodium intake, the more your body also retains the water. So sometimes when you think, you know what, I'm cutting my calories, I'm cutting my sodium, I'm cutting my cholesterol, my carbs, but you're still keeping on the weight while you're retaining it. If you look at the label and look and see how much sodium is in what you're consuming, that is also a big driver of why you may be maintaining that weight or not losing it. And you know the difference, because if you look at your numbers and you cut down on your sodium and you feel it, then you go back the next day and have something that's got sodium in it, you will feel the immediate difference. And that's how you can really tell how the impact the sodium is having on your body.
You know what, I love this platform, and this is one of the goals of it, is to educate and enlighten one another. There's so much to learn from one another, and this is why it's important that we do share these experiences. We do share this knowledge, because knowledge is powerful. And Brother Brian, I thank you for sharing, because it seems like you have a lot of experience with what you're going through and watching your intake, so that you can live better. So I definitely appreciate your testimony and what you've been doing, and even watching your sodium intake. As we continue, one of the issues we have is there might be some health professionals. I'm sure there's some health professionals on the call, but I know I'm not a health professional, and many of us on the call, we don't consider ourselves health professionals, even though, we do take our health seriously. Some of the challenges is, where do we get reliable health information? There's a lot of information out there, but what makes finding, understanding, using that health information difficult? Science is always changing. What might be true today might not be true in a few months. I think we observed that with COVID-19. In fact, with COVID-19, it seemed like every 2-3 weeks, things were changing. Can someone just speak to some examples of changing health information that they've observed recently within the last 2, 3, 6 months, or even a year? Don't be shy. Let me check the chat.
Well, one thing I did, you hear all this stuff and oh man, take the bee pollen pills. Oh, take the take the echinacea, all these things. So what I did was, I put down, before my doctor visit, I put a list of all of the things that I had heard, and some of these over-the-counter things that I had taken, all these things. And I brought them all to my doctor. I went in there, I said, listen, I want to go through my list of all these things that I take and things that I've read. All of my numbers for what you see. Tell me what I keep and what I get rid of. I gotta say, 3/4 of the stuff that I thought was taken, he said, you don't need all this stuff. If you eat a proper diet with vegetable, you'll have more than enough, and you're gonna save yourself a whole lot of money instead of you buying all these different things, because you're trying to find a supplement to replace what you can get naturally by eating more vegetables and and having portion control. So, and that is something that's big on helping me, deal with the health information, because I'm going to the doctor that actually knows my numbers. Because I find sometimes when you go to these esoteric websites or whatever, it may give you a recommendation, but again, that's a generic recommendation, which is not based upon your specific numbers. While when you go to your doctor has your lab results, all your numbers, and they can tell you this is where you need to go and the direction you need to go, because they have accurate proof about you specifically, and not some general thing that's out there. But,
Exactly, Derek, and that speaks to something also that Kadian, I hope I'm saying her name right, Kadian Russell put in the chat. Hopefully she doesn't mind opening up her mic on this evening, but she says she's a nurse, so I'm glad we have another health professional on the call, and welcome, Kadian. She's a nurse, and she says you definitely have to advocate for yourself, especially as minorities, and she put in there WebMD is not your friend. Ms. Russell, will you open up your mic and talk to us a little bit and share? Go ahead.
No problem.
I hope I'm saying your name right. Am I saying it correctly?
Kadian.
Kadian. All right. Thank you, Kadian.
No problem. Like I said, definitely advocate for yourselves. Going in the ER as an ER nurse, you see a lot of doctors be dismissive of minority patients. There's studies that show that they obviously downplay, like if you complain of pain, they'll give you Tylenol, versus the white person that complains of pain, they'll give them morphine. So definitely advocate for yourself. Know your medical history, because many times people come in there and say, oh yeah, I have a history of high blood pressure, diabetes, but they don't know the specific medication or the dosage that they take. So we can't effectively treat you if you're not knowledgeable about your own personal history. Patients come in all the time, oh, I was on Google or I was on WebMD. Stay off of that, because sometimes the information on the internet is not accurate. So speak to somebody that's knowledgeable. Like, I'm pretty sure all of us have at least one friend or one family member that's in the health care profession. So definitely tap into your personal resources.
Thank you, Kadian. I appreciate that, because it follows into the next thing. It's important where we get our health information. I would love for people to share, where are you getting your health information? We know we have our primary doctors, some of us, but if we don't have a doctor, where are we getting our health information from? What are some other sources that people are relying on, whether that's good, bad, or indifferent? I'm just curious if people would be willing to share where they're getting their information from.
Well, for me, I have a lot of family members that are nurses, such as my mother, my grandmother, and my aunt. And also, I get a lot of my information from my trainer, especially when it comes to doing an in-body test at the gym to check not only my weight, but to also check other things in my body as well. And I also check the internet. There are times when I do check the internet, especially when I have to do my calorie counting, especially when it comes to cooking certain meals, in order to make sure that I am having the right amount of calories and making sure that I stay healthy as much as possible.
Okay, thank you. I appreciate you sharing. We also have in the chat, Monica said she reads journal articles. I like that. Many of us do that as well, which is going to lead to another question coming up soon about trusted sources. I think this is very key. We have someone, Brandon, put in there, when you do see your healthcare provider, be honest. He says he's worked in emergency medical services for 7 years, and on the ambulance, we'll ask patients what's going on with them and their medical history, and they'll tell us one thing, and then the ER staff something completely different. It is important to be transparent. We can't get the best medical treatment if we're not being honest, or we don't want to mislead someone and then something else happens that we didn't bargain for. So it is important to always be transparent, always be honest. And Kadian is also saying, once again, she's agreeing with it, transparency is key. So many times we get conflicting stories. Yes. So with that said, know better, the trust test. When we look at these symbols, all stand for different things. And this is very, very important for us, because when we look at, and someone, Monica mentioned reading journal articles and what have you, these are things that we should be, wherever the source is, whether it's our primary care doctor, whether it's journal article, whether it's somebody telling us something, a friend, a neighbor, colleague, our pastor, you name it. These are some of the questions we should always be asking. One, how old is the information? What is the source? Is this person or organization, are they an expert in that field? What did they say? And what is the proof? So we're going to go through one. We're going to go through an example of something. I'm going to give everybody a few minutes to look at this. And then we're going to go and we're going to put this through the test to see if you would say this is a reliable source. I'm going to give everybody a few seconds to look it over. And then we're going to talk about it. Is this something that we feel is an accredited source? Or is this something that we think, it seems a little shady? We're going to put this through the trust test. This was found on YouTube. So when we talk about where different places we find information, this was found on YouTube. Okay. So tell me, what does this description say? Anybody? Unmute yourself. What does this description say on YouTube? Talk to me. Or better yet, how old is this information? Let's start there.
The information is a year old, but it's from pretty much one of the preeminent teaching hospital systems in the country. So I would trust this source.
Okay, all right. Let's go back to the first comment. He said, he noticed the date there, 2021. Do we agree? I mean, how many of us have a problem with that being almost a year old today? Actually, it is older than a year today. Any of us have a problem with the date?
Yes.
All right, talk to me. Who said yes?
Florence Rice.
right.
Things change so fast in the science field, and we've seen it. We've seen it unfold day to day.
Okay, all right. So Lauren says she would have a problem with this being a little bit, potentially being a little outdated. Anyone else?
So I agree this is Herman. I agree as well. We're learning new information because it seems like the experts don't always know, and things are being redefined, clarified. And so if there's something that was developed in 2021 and the explanation is from 2021, I might look for a more updated source.
Okay.
Just to be sure.
I like that. Thank you, Brother Mazard.
I differ a little bit. I do understand timing and information, but I think the information that it is providing is still relevant because it's talking about the development of this mRNA, and the fact that that didn't change, that it's been being developed for decades. And how does it work? talk about. I
Right.
think that's we can talk about.
Mhm. Yep.
Okay,
Right.
seems like we got some mixed opinions about this, which is good. Some feel like it's okay, and then some feel like, you know what? Things do change rather quickly, and we may want to get something more recent. So I like the conversation that we're having with this. Now, one person mentioned on there that the source, where it's coming from, which is a question that we got to ask ourselves. And they said, you know, paraphrasing, but this is one of the top schools in the country. Looking at Johns Hopkins, is this a source? Just looking at that as a question that we would trust primarily. I see some heads nodding.
This is Joe Sullivan from Kappa. I would click the link to the .edu site to get it directly, because sometimes people will provide misinformation and put the link there to make you think it's legit. But in this case, it looks like the content's legit, but it's always best to go to the original source.
Okay.
But I also too, I think it would depend on the subject matter. Like Urban said here, or some of this stuff. I'm getting a little bit okay on the date, but like when it came to COVID, there was just so much misinformation out there, and there are all these scientists that are doing their research that I just said, you know what? Let me just go to the CDC and just go to them, because this is what their job is. And so I just go to CDC and I would see the information, and it's a pretty good site. You know, they break things down, you know, so that a normal person can read it, and it's not, you know, a lot of medical jargon. So even if this said this, I was still validated against what I see in CDC, or basically I would go the other way. I would start with CDC, and then I would use that as my reference source, especially for the topic, right?
At that time, because of the administration we had, I don't know how much we was relying on the CDC.
No, but I still remember they were independent, right? So, and they always conflicted with the person in charge at the time. So that's why I went to them specifically, because they were giving contrary information. So you know, and honestly, prior to COVID, I rarely even heard of the CDC, you know, and so that really brought it into light, you know.
Now, these are all good points, and I want to go back to what Brother Joe Solon said not long ago. The one thing, and Derek, actually, you alluded to it as well. Sometimes it looks good, but we might want to look and research a little bit deeper. And the one thing about this particular source, as we look at this YouTube article, posting, whatever we want to refer to it as, the one good thing that it does have is a link. So therefore, they gave you a little snapshot, but if you see right here, you can't click on that link for more information. And that's where we want to validate. That's where we want to get the evidence. So typically, I would say this seems like a reliable source, or something that we may want to take seriously. Would you agree, just based on those factors there?
Yeah, but also too, the other part that's not here is when you look for, sometimes people use I call it Dr. Google to find what they want to find. In other words, even if they find something like this that sounds reliable, they will find some other website that will tell them the answer that they want to hear, and they will use that. And that's almost as big a bigger problem than you finding, you know, a reputable one that may say something else. So that's a huge problem as well.
Yeah. The key with this one, Brother Brian, is that it goes back to the site of Johns Hopkins, and it shows the evidence and the research that they put into it. Now, with anything, there's still going to be questions, regardless, especially when you're analyzing, looking at data. But for the most part, it tends to lean this particular thing more, I would say, you know, everyone has their opinion, but I think if we took a vote, many would say this is one that we might consider a trusted source of health information. Now I'm going to give you another one for you to take a look at and let's talk about. This was another social media post. Take a look at it and let's put it to the test.
I don't trust anything on social media.
This is all someone's opinion.
Yeah.
There's no evidence for anything. It's just kind of a hearsay thing.
And it's clearly from somebody that's still doing their research on the COVID vaccine.
Yeah. One, we don't have any date. We don't have anything that can link us to any evidence. We don't even know where the source is coming from. So this is not something that we would treat seriously. Or is there someone out there that begs to differ with that opinion? Would love to hear from you on that as well. Few people, Rosalind in the chat said, sounds like someone sharing their personal opinion. I think many of us would agree. So would this be something that we would consider a trusted source?
No.
No. All right. Now, know better. We know, even though COVID is not on the news like it was when it first hit, I think we all would agree COVID is still here. Will we say definitely, yes, COVID is still here? It has not disappeared. Many people are dealing with the after effects of it. Most of us at some point in time may have had COVID. Some may even be going through it now or know of a family member now as well. But let's talk about, when we look at it, these are some of the ways that we know when we talk about how it first hit the scene, and how you can contract this deadly disease, potentially deadly disease, and it's killed many. But let's talk about the 3 ways that we can get it. In fact, does someone even want to share their experience if they had COVID-19 and does not mind sharing? I would love to hear a story or their experience.
Yeah, Brother Bratcher, this is Robert Bowen.
Go ahead.
You don't mind, I can share. I actually caught COVID volunteering on Veterans Day. I was out and I thought I was being careful, just like everybody else, as far as having my mask and stuff like that. And then the next day, I tried to go to work. And at first I wasn't feeling right. And within an hour at work, I could barely walk. So, you know, for me, I'd heard all the stories as far as COVID. And of course, this is around the time where no one, you know, the vaccines weren't made yet. I would say that a lot of important things weren't talked about in the media or really talked about ad nauseum as much as, you know, they probably should have. So for instance, the effects, the after effects, right? I know for me, the hardest part of having COVID was not during the actual COVID symptoms, but the after, when it felt like I had to recover from, you know, like a major surgery or something like that. The recovery was grueling, where your body feels as if you're drained of all energy. And then, the talk of loss of smell and stuff, was talked about a little bit, but, even feeling weaker, it wasn't really discussed as much as far as the after effects of COVID. It was just, trying to prevent COVID. What could you do if you got it? And it was only maybe a couple months after the vaccines were created that at least to my knowledge, from what I've been hearing, the discussion started to become more about, the lasting effects of COVID, the loss of taste a little bit, the loss of smell, regardless whether you were vaccinated or not. So, that was my experience. And until that point, I hadn't heard anybody really talk about, the physical effects of it, after, once you were done with COVID. So I just wanted to share that with the group.
And I appreciate you sharing that, because a lot of people, and this is why COVID is still around, and a lot of people are dealing with the after effects of it. I too caught COVID about, I would say 7-8 months ago. And I have to be honest with you, there were 2 days during that period that I actually was afraid to go to sleep. I was sweating crazy. I couldn't stop sweating. I felt like I would check out if I went to sleep because I was having problems breathing. I personally felt a lot of people died getting on those respirators in the beginning because we didn't have the information. And to find out later that when they started, months later, they stopped putting people on there when they went to the hospital. But in the beginning, it seems that might have even caused the death of people. So I was staying away from the hospital, trying to, nurse myself better. And thank goodness I'm still here to share my story, but I lost my taste and everything. Thank goodness I feel like I'm back from it, but it's not a good feeling. And for me, I actually thought, I was just afraid to go to sleep because I didn't think I would wake up. But when we talk about COVID, it's still here. These are ways that we can catch it and to prevent it. If these are the ways that we can catch it, what are some ways that we can prevent catching it? What can we still do today to help our chances of not contracting this virus?
Yep, brother, I would say, and again, this is just, me personally, I feel like this is it's the new flu. Definitely would say, as far as, if, whether it's a mask, and even, all of us on this call have probably heard the different opinions on masks and which masks are good and which masks are bad. But the vaccine, I would definitely say, is the best course of action, right? But, at least to my mind, this isn't something that, will ever go away. That, this new disease is something that you can do everything right, vaccine, booster, and you'll still contract the virus. So.
And you're absolutely right. And thanks, Robert, for sharing that. So when we talk about things that we can still do today, we can still wear our masks. And I would encourage you to, especially if you're in large audiences, washing our hands and washing our hands thoroughly. This is something, regardless of COVID, we should be doing regularly anyhow. And depending on where you are with this, I can't tell you to get vaccinated. Everybody has their own beliefs regarding that and their own personal situations that they're dealing with. But we do know that the vaccinations, they do help. At least we have enough evidence now today to say that it's been helping this virus. So things to just take into consideration as we continue to deal with this. And Gideon agrees, first line of defense is proper hand washing. So let's continue. And let's continue to be advocates too when we see other people that are not washing their hands in men's or ladies' room and people are just walking out and what have you. We got to make sure we're holding one another accountable in some cases, or as simple reminders. We talked about, Robert also talked about getting vaccine and boosters, COVID-19 tests, isolating, quarantine, mass indoors. Once again, these are all things that we can do to help our situation with COVID. Does anyone now today know someone that's dealing with COVID and how they're going through it that would like to share? anybody on the job and their family that's going through it now currently. And if they're having an easier time, you feel, than that first wave that hit people 2 years ago, so to speak now. You can unmute yourself.
Hi, this is Carrie Ann. My nephew right now has COVID and he's dealing with having a fever, a sore throat. He had it before, I want to say about a year ago, and his symptoms are pretty much the same. So he's still having, I'll say, a hard time like what he had before. So nothing much has changed. And yes, he is vaccinated.
And he's vaccinated. You said this is the second time he's had it?
Yeah, this is the second time. He had it about a year ago.
And he's vaccinated. Okay.
Mhm.
So this is a sign, guys, that it's still here. Thank goodness he's still here to talk about it. So she mentioned that he's vaccinated. Here's some data for you to just read over quickly when we talk about vaccines in general. But staying focused on COVID-19, take a look at some of the benefits and some of the risks when making that decision, if you haven't or you're still considering about the vaccination. In fact, I know we have some health professionals on the call. I would love to hear from one of our health professionals regarding this slide right here about benefits and risks. Please jump in and give your opinion about what you see on the screen.
This is Kadian.
Thank you, Kadian.
Definitely that I've personally experienced less likely to be hospitalized. Although a lot of them come in with COVID symptoms and might have been diagnosed with COVID, more likely we're discharging them home from the ER as opposed to being admitted to the floor. Those who are usually admitted are the ones that are not vaccinated.
Okay.
I agree with Katie, and this is Erica. Those that are suffering or struggling or having severe symptoms are ones that are either not vaccinated or they're due for boosters, definitely have comorbidities. They have other illnesses that's underlying. And that's typically what we see when it comes down to hospitalizations and now new COVID infections.
Yeah, the comorbidities are big. Those things that are contributing, like you said, the chronic illnesses that contribute to just generally being ill already. On top of that, you're getting COVID, and it just makes it harder for your body to cope with it.
Absolutely.
Well, I was going to actually ask, like I said earlier, I'm setting up all my shots, the shingles, the COVID, the flu, or whatever. But then I saw something on CBS, who I'm guessing gets it from CDC, said that their studies showed that it's okay to get the COVID shot and the flu shot the same day.
Yes.
All right, I just want to get that because I didn't do it. I basically I'm gonna get my COVID and my shingles one day, and I'm gonna do the flu shot the next week. But what you read and what you've seen is fine to get them both on the same day.
Yes, it's there's no harm, no foul receiving both vaccines. If you think about it, even in childhood, children typically get multiple shots. The same concept of being able to receive 2 vaccines in the same day is even more, it's helpful because right now the flu that's circulating right now is, again, we know annually is different. It has a different strand to it, but it also leaves you with one hand out the fight. So having a flu vaccine on top of the COVID booster is very helpful.
Thanks, I appreciate that. It's good.
So I wanted to respond to that. This is Herman again.
Okay.
So I think there are 2 issues at play. One is the efficacy of the vaccine. And I think what the young lady who spoke just before me spoke to is that they don't cancel each other out, or they don't, there's not a problem with both of them being introduced to the body at the same time. But then there's also the issue of recovery time when you're getting multiple shots. When I was, 5 years old and getting a shot, I recovered in a matter of hours. But, when you're 40, 50, maybe 60 years old, maybe it takes a while to recover. And so that's why you want to space out. Because I would space the vaccines out as well.
Yeah, I can piggyback right back off of that too. The vaccine affected different people differently. So, knowing your body, and like you said, having a history with, taking multiple vaccines at the same time, you probably could use that, that wisdom, going forward, definitely not be harmful. The most important thing is that you eventually got them all, would be the most, expected outcome. So I agree, it really depends on the individual.
Thank you, and I'm glad, and thank you, ladies, for joining the call. It's great to have professional healthcare workers with us, and I can't stress enough the education. When you know better, you actually live better, or we should live better. Knowledge is power. So I like that we're sharing. I like that we're having this discourse. We're talking, and then the key is just to spread this and spread this knowledge. This is a great platform. It's a great start, but we got to keep this going, because there's still challenges out there when we talk about accessing a healthcare provider. Many of us on the call have great healthcare, good jobs, great healthcare plans, and what have you. But that's not the case for everyone. So when we talk about accessing a healthcare provider, what are some of the challenges that we can help others, if we're not in that boat, overcome when looking for a healthcare provider? Please, let's keep the conversation going, because this is very important.
I can share, when looking for a healthcare provider, one, an individual has to feel comfortable, welcomed, and also feel that they're going to be informed and, provided with, truth and honesty. And you could do that by, vetting someone out that you are comfortable with yourself. There's a lot of different resources. We can look up every provider that takes care of us, their credentials, where they went to school, if they have any opening cases, depending on your insurance. Sometimes you might feel that you're treated a little bit different, but you are the consumer, you're the shopper. So you're entitled to the healthcare, access that you receive. So you don't have to, be slated to one particular healthcare provider. The most thing is that you want to make sure that your healthcare provider is, free enough to educate you, answer the questions that you have, also see you in a timely fashion, and again, be able to, provide that after education that you might need if you're not clear on what it is that you're dealing with. Some of the challenges, of course, we know with health disparities and some people not having access to healthcare, that's a big challenge by itself. Transportation is another challenge, but the waits, we have to wait to see our physicians. If you was to even right now, we started out tonight talking about Know Better, Live Better, but then we said, how do we schedule these annuals? If you was to call today, could you honestly get an appointment with your doctor next week? Probably not. You might have to wait a month. So that's a challenge. Being able to get an appointment to see your doctor for 15 minutes, but then you're waiting 2 hours in the waiting room. Those are all challenges, and those are things that actually deter people away from going to the doctor. But we want to encourage people to, push past that and try and find a healthcare system. We don't promote any particular healthcare system, but there are healthcare systems out there that have learned how to work smarter and not harder. They reach out to you. They have online portals. They call you before your appointment. They get you prepped before you come, so you can fill out most of your paperwork before you get there. I would say that those are probably the best care facilities that you should engage in, and make sure that, you're comfortable with who's actually, seeing you in that room.
Wow, thank you for sharing. You just dropped a load, a bunch of jewels on our audience this evening. When I think,
Absolutely. And be comfortable with answering, asking questions.
when I think of this next slide, you spoke about a lot of these things. But some people do get slighted, do get discouraged. And you're right, sometimes for a 15-20-minute appointment, you're waiting 2 hours or 2 months just to get that appointment. But the key is, and I like that you said, is that these are what we call barriers, but we have to push through it. And we have to make sure our family members, our community members, our co-workers, and everyone that we are in contact with, they understand this, because at the end of the day, health is wealth, and we need to make sure that we're doing a better job staying healthy.
I'm sorry, on one thing on the challenge, on getting a doctor, it's just almost impossible to get, but what I found amazingly, and again, they probably were in New York City, but I just, didn't pay attention to it. But the urgent care, the urgent care is amazing. It's basically, you don't have to worry about an appointment. You could just show up. And especially if you have a urgent care and it's not COVID, you can almost go right in, because, the COVID appointments for some reason, I don't require more, I don't know. But I find that the using urgent care is a huge, I don't know what, positive thing. If you have to deal with any kind of you can't go see a doctor tomorrow, or there's a wait. The urgent care is like right there, it's open, and urgent care is up here, it's almost open every day. So, and especially, I got 2 little kids, and urgent care has been a lifesaver.
Agreed.
I've had good experiences with urgent care as well, but I'm glad you said up there, Derek, because I don't think every community is like that.
It may not be every, but I'm just like the cases that I needed, where like my insurance, if you go to the emergency room,
They'll kill you.
and the insurance company considers that not an emergency, I get charged $500, right? While if I go to the urgent care, and the urgent care is like, all right, look at it, and the urgent care says, hey, listen, it's serious, go to ER, then it's all covered. Well, urgent care is like, hey, this is what it is, let me make your prescription, and it is done. So my experience with them, and where I am in Westchester, I've got like 3 near me. I got Northwell, City MD, and I got West Med. So
Well, I just want to reiterate again. You said Westchester. Every community don't have the same access.
oh no, I'm not saying this. It may not. And again, when I lived in Harlem, I don't remember where the urgent care was. I don't know. I know since I moved here, I've been able to utilize the urgent care, and that has gotten over the challenges of not getting to my doctor for weeks when I've got something going on like right now.
Yeah, no, I attest to urgent care, at least in Westchester, around where I live as well. And Derek, we live in close proximity, and has actually been a blessing in disguise. And I actually like the fact that they have, the hours are a lot flexible too, something to take into account. I do want to bring to your attention, guys, in the chat, and thank you, Farah. She's put some resources in there for you as well. Program handout, resource sheet for you to use too. Some great references there. So when you get a chance to check that out as well. Florence, I saw that you had unmuted yourself at one point. Was there a comment you wanted to say? Or are you good now?
No, I'm good. I'm good. I was just agreeing.
Just agreeing. Okay.
My husband wishes to add that the VA, he goes to the VA for a lot of his care, not all, but for a lot of his care. And they are very proactive. They call, make sure he comes, blah, 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 blah.
Okay.
Very, very good. He's very satisfied. He goes to the Montrose VA and sometimes to Castle Point, but he served his country well, and they served him well.
And tell your husband we thank him for sharing and being on a call, and we thank him for his service to our country, and we're happy to hear that he's getting good health attention whenever he needs it. So on behalf of everybody on the call, tell him we thank him. All right. So now we're prepared for that visit. Many of you had mentioned this earlier in the chat. Full disclosure, no secrets when you're going for your healthcare visit. Know what your symptoms are, come with some questions, let them know any medicines and things that you might be taking. It's very important for them to know exactly what's going on, for them to give you the proper treatment. And I think we all would agree with this. We got to come prepared to have answers for our healthcare providers. This was something that we added here, and I think it's important when you look at it. Ask Me 3. Take a look at that. Tell me what your thoughts are about that after a doctor's appointment. And our healthcare professionals that are on the call, you tell me, do you agree with those 3 things, or is there anything that may be missing that we should add to this as well?
No, I think these are very key. It kind of goes right back to what we said about having some authority and being confident when you're in the room with the physician, making sure that you walk out knowing what your main problem is, what it is that you want to, leave out as far as information. What do you need to do? And what do you need to do, how do you know when you should come back and not wait, for another acute flare-up, but having control? Because just because you have a chronic condition doesn't mean that it has to have you. We can have chronic illnesses, but we don't have to be led by the chronic illnesses. So I think knowing how to navigate that meeting and getting all these questions answered is a very good framework.
Thank you. I'm glad you find them very helpful. Would anyone else like to add?
It's also an important point. You came into the doctor for a reason, right? You had some issue, some medical issue that you needed addressed, or a question that you needed answered. And if you leave there with the same amount of knowledge as you came in, that was a wasted opportunity. So you need to make sure that you're asking questions to understand what it is that you came in there for. Otherwise, you just wasted your time.
They wanted.
Yeah, no, and we can't be afraid to ask questions. They're professionals, but doesn't mean that we got to trust everything, or that we may not have some doubts or may need further explanation. So going there, and before you leave, you shouldn't leave still walking out there not knowing answers to things or any of your questions. So go prepared, be ready to have those conversations, because at the end of the day, it's your health that's at stake.
Oh, and also what I find helpful is if you know your appointment is, whatever, the 15th, go get your lab work done before the doctor appointment. So that when you go to the doctor, he can look at your lab results and go over that stuff with you there. Because I find, when it's happened the other way around, it's kind of like I go to the doctor, then I get the lab results, and then if I can catch him to get an update, whatever. However, when I go to the lab, get the lab done, the doctor has it in his hand, and he can look at the chart and say, look, yo, man, what are you doing? The cholesterol is high, the sodium is butter, whatever. So when you get the lab work done beforehand, you can have a more meaningful conversation at the appointment there, because now the doctor can tell you exactly, specifically what your numbers are saying. That's what I find helpful.
Yep.
Right. You know what, Derek? That's a great point, man. Great point. I'm telling you, I'm learning a lot and I'm facilitating. I'm learning a lot from you on the call, from everyone on the call. And this is why we got to have more forums like this, because when we know better, we live better, we do better. But we got to get this message out to more of the masses. Some of the resources, and once again, thanks, Farah. I know she put some of these things in the chat for you to click on. We also, you give us your email, we can send you a lot of these things. So it's very important when we talk about trusted info sources. I would say doubt everything and continue to research to make sure there's ways that you can prove it before just taking anything at its face value. But that's me. Our healthcare professionals, would you agree with that statement to some degree? Katie, and you're still there? All right, we might have lost some. Farah says, if you see something missing from our website, feel free to send feedback. We're happy to keep the resource page updated. All right, we're coming towards the close. With that said, what is your plan to know better, live better? Give you some opportunity to read over some of the bullet points there. This is key. When we have these forums, there should be takeaways, things that you take away and say, you know what, I'm gonna start doing this. I'm gonna make sure. We talked about a lot of different things. Getting vaccinated, coming to the doctor with questions, getting your blood work and things taken care of before your visit. How to go about analyzing whether something is a trustworthy source or not. These are all good things as we continue to know better, live better. We are here to help. Please, even if you have your phones and you want to take a picture of this, because I know it's tough for you to always remember, you can take out your phones, take a picture of this slide. You can email that email address. And when we talk about reliable sources, you can go to the website. There's a wealth of information, a wealth of knowledge there for you to visit, ask questions about, and we'll get the answers to you. We definitely want to take this time to thank you, and thanking you, we ask because we want to keep this going. This is the first one of our 4-group session. The next one is happening Tuesday, November 15th. Once again, if you have your phones, take a picture of this page where you can lead and send and text message friends and lead them to it. The same way you registered, they would go about registering. We really need to spread. We should have hundreds of people on a call because this is how we help one another. This is how we grow and keep our communities alive. This is how our generations to come will not go through some of the illnesses and sicknesses that our parents went through and that some of us had to go through just by having the knowledge and the wherewithal to eat better, live better, exercise, watch their sodium intake, their sugar intake, their cholesterol levels, everything that was discussed tonight. Before we end this evening, there is a 1-minute post-session evaluation that we would love for you to fill out. And I would also, I know our worthy Polmark would love to say a few words. And I just want to personally, once again, thank you all for sharing this hour 15 minutes with me. I found it very beneficial. Hopefully you did as well. And I appreciate your time. And this is the only way we're going to continue to improve our health literacy and improve our communities. Brother Griffith.
Sure, thank you. And thank you, Brother Bradshaw, and great job, excellent job. If somebody would have told me this was your first time, I said, nah, you gotta be kidding me. He must have done this before, but great job, great dialogue, and great to see you all here. So just a couple of things, a couple of takeaways, and I usually do this at the end of each session. I take some notes and just share some of my notes at a high level with all who are on. And starting from the very beginning, what I think is important was what we first started off with was do the best you can until you know better. Then when you know better, do better, right? And that's what this is all about. It's all about providing each and every one of you with information so that we can do better. I like what Mark said, health is wealth, that's key. Derek, go to the doctor. And I mentioned this earlier too. A lot of us don't go to the doctor. We need to make sure we make those annual visits. Me personally, every year, well, I go multiple times a year due to family histories, but Every year I get a full physical right around my birthday, and I make it a point to do that. And I've been doing that for like the past 25 plus years. So set a date for when you're going to do your full physical. If you have any family history and you need to visit the doctor more frequently, by all means, please do so. Setting goals from a health standpoint, I like that. And one of the things you have to do is like really challenge yourselves, because I hear a lot about health goals, a lot about going to the gym. I'm going to do this, I'm going to do that. I would say
Bedtime.
get your
Get the toys
partner.
away.
Can you go on mute, please? If in fact you need someone to help challenge you, whether it's your significant other, whether it's a friend of yours, do that, because that's going to help you keep that commitment. Because if you're just making that promise to yourself, a lot of times we go back on those promises. Something Irv Crusoe mentioned, which is important too. Sleep is as important as diet and good health. And I think each and every one of us sitting here on this call can probably say we don't really get a good night's sleep. I know I don't. I don't sleep 8 hours plus. I don't think any of us do. But let's start trying to do that. Going to sleep a little earlier at night. Being transparent with doctors or healthcare providers. That's important, that we let them know everything that's going on with us. I think it was Brandon that had mentioned it. That he was a EMT and he gets information from patients, and then when they get to the ER, it's something totally different. So let's be transparent with our healthcare providers. What can we do to prevent the spread of COVID? And yes, I know Brother Bowen mentioned it's like another flu. It's out there. It's not going anywhere. We have to do our best to prevent it. Whether it's wearing masks in public places, washing our hands, something as simple as that. And it still baffles me at times where sometimes you go to the restroom and people just walk right out without washing their hands. I mean, not only is that not good, but it's not really healthy. And a lot of people are still out there doing that. So something as simple as washing your hands, let's make sure we do that. Again, wearing masks in public places, that can help prevent the spread. Spacing out the vaccines, that was talked about briefly. And me personally, and it's just me, I get a bad reaction to the COVID vaccine, and I had full vaccinated, and I also had my booster as well. So I also get a bad reaction to my flu shot. So me personally, I can't take all of them at the same time. I do have to space them out because I literally feel like I'm coming down with the flu when I take both of those vaccines. So if you can do it, that's fine. I know Brother Mazard mentioned, some of us in that upper age category, he mentioned 40s, 50s, 60s. I'm somewhere in between all of those numbers, but yes, I can't take all of those vaccines at the same time from a personal standpoint. And make sure your questions are answered when you leave the doctor. And this is something that when I come home from the doctor, my wife is always standing at the door. So what did he say? What did he say? What did he say? So make sure all of your questions are in fact answered. And sometimes what we may have to do too, as you're going to visit the doctor, is write down some of those questions. Because a lot of times, you're just thinking about getting in and getting out, and you forget to ask those important questions. And you forget to ask about sometimes your blood work, right? So if it helps you, write those questions down, so that when you're leaving the doctor, those questions can be answered. So again, thank you all. I'm going to turn things back over to Paul to close things out. I don't know if Farah has a few words she'll like to add or not, but thank you. And tell a friend about this, because this is very important. I think we all learn a lot from these calls with the information that is disseminated amongst us, and as well as the conversations that we're having with each other. So thank you again. Spread the word. And Brother Paul Bradshaw, I'll turn things back over to you. Thank you.
Thank you, Brother Griffith, worthy Paul Mark. Farah, is there anything else you want to say?
Just very quickly, thank you. This was a wonderful discussion. I enjoyed listening. Like I said, I put a quick survey in the chat. It, again, is voluntary. We will be sending your Amazon gift cards using the email that you provided on the Zoom meeting. We will also send you an email in 3 months asking more questions to see if anything has changed since this session. This is another way for us to determine if this is helpful and to encourage our health department leaders to invest in this program. When you get that email in 3 months and you don't want to fill out the survey, you can delete it. We will not send you any other emails for any other reason, that's the only one you'll get from us. If you do decide to complete it, we will also have a question at the end, so you can sign up for another $10 gift card to thank you for filling out that second survey. So that's all from me. Thank you again.
All right, I think this was wonderful. I invite those that may want to join us in November to please come back. You really made this a worthwhile session with your input and your insight. But more than that, just please share it. That's how we grow as a community. Share this information, invite people to join us in November. Thank you, everyone, and have a pleasant evening.
Are you ready for that? Yeah. Whenever I got no money, she is still my honey.
Farrah, stay on for me.
Cause I say that. I don't care what you say, but you can say, girl. Keep on saying your thing, yeah. And I don't care what you do, but you can do, girl. Keep on doing your thing, yeah. And I don't care what you shake, but you can shake, girl. You have my head to spin, yeah. And I don't care what you kiss, but you can kiss, girl. You have this word I sing, that people keep on telling me that you're here to stay, yeah. But I keep on telling them that you will go away. Cause why? Two wrongs can't make no right now. Ain't nothing wrong with a good old fight, yeah. Call me damn name. Instead of bring me joy, you brought me pay. Now I really know what is the game. Bust your brain, blood for stay. Sometimes I really thought your love was so true. Cried on my shoulder, but not all too. Now I really know what just to do. Forget you too. You and your crew. People keep on telling me your love is here to stay, yeah. But I keep on telling them that you will go away. Cause why? Two wrongs can't make no right now. Ain't nothing wrong with a good old fight, yeah. It's all right now.
Once again, good night, everybody, and we hope to see you soon at one of our events or back on another session. But we really appreciate your time, and hopefully, once again, you walked away with some sort of information that was helpful to you and that you'll be able to share.
Nicely done, Brother Bradshaw. Really well done. Lots of good information. I'm glad I attended and I got a lot of good takeaways, and I really do like the handouts. I didn't have to take as many notes. Farrah did all the note taking for us.
Thank you, brother. And thank you for your tech work, man.
Absolutely.
Music, the in and out and everything. It was just a nice touch.
Great job. Great job, everyone. Great job.
I guess we got some people still that maybe they walked away, we can remove from the room.
We can do that. I'll take care of it.
Keep Farrah in the room.
But of course, she is the room.
Okay.
How did Farrah just get into the waiting?
Great job, brother. Great job.
Thank you.
Thank you. Thank you.
Was that Leroy? Was that Brother Leroy Lewis?
Yes.
All right, Brother Leroy. How you doing, good brother?
Who else would be there besides the scientist?
This is true. This is true.
And the cat, who has better health than we do. Oh my God.
Is the cat there too?
Of course.
Once again, Brother Lewis, thank you for your service to our country, and thank you for everything that you have done.
And thank you, Sister Price, for joining us as well.
But I just want everybody to know that they can go to the VA. It's very helpful now. A huge change in the VA now. Big change. You know, they do not want any bad publicity.
Good. Good.
All right. Good night, Brother Lewis. Glad you joined us, you and your wife.
Very good. We were here last year too, but we have another meeting on Thursdays. I think that a lot of these things were on Thursdays last year. We joined one of them, but I'm happy they're on Tuesdays. We don't have a meeting that day, so.
All
Very-
right, excellent.
And
Spread the
excellent.
word, spread
And,
the word too, Sister Rice Force, okay?
Absolutely will do.
All right, take care.
Take care. Thanks. You did a great job.
Yeah,
Thank
really nicely done. All right,
Thank
let me just take care of this here.
All
And
right.
we have just us four are in.
All
Oops,
right,
actually,
Farrah.
no, no, hold on,
All right.
hold on. Hold on, Farrah's got to
knocked-
come back in.
You knocked the wrong one out.
You're not
Hold on, hold on.
Pharaoh?
Yeah, I did. Hold on, that was my bad. Sorry, Farrah.
Sorry, Farrah.
That was my bad.
Out.
It was so close to Florence. That's what the problem was.
All right, okay. So Farrah, this was my first time, as you know. I just, feedback is good. Constructive feedback. I don't take things personal. It's all about growth. Would love to hear from you since you've worked with a lot of trusted messengers.
Yeah, no, genuinely, this was great. I think it went really smoothly. You went through all of the topics. I mean, if I had to give any, feedback for changes, I would say if you feel personally that staying too long on the COVID slides is going to get people to lose interest, feel free to move through them faster because I know there is some COVID fatigue. I also know that some of these individuals may have seen a previous session where COVID was talked about more extensively. So